Hello, hello, hello. All right, welcome everybody. Ooh, we have a big group today. I'm excited. Okay, well, let's go ahead and get started. My host should be sharing his screen very shortly. I am your host, Dr. Adams. Some of you had your history visits earlier this week, and some of you had them last week, and some of you will be doing your history visits virtually with me in the coming week. So, welcome to you all. This is a little something that I do every couple of weeks to make sure that all of our guests feel welcome and warm and oriented to the practice. So, welcome to the Full Circle Women's Care Practice and Pregnancy Orientation. Couple of housekeeping items first. This is confidential, so no one else can see that you are on the call. I will get a list afterward of who was here, but during the call, you can ask whatever questions you want. You can participate in the polls. No one will know that it's you answering. And if you have to hop off at any point, just know that this presentation will be available on our YouTube channel throughout the duration of your pregnancy. So here's an example of how our polls go. So first thing I want to know is who's on the line. And it's important for you to answer because it will also kind of choose our own adventure in terms of what I say next. So what I would like to know is how many first-time mamas are on the call today and how many veteran moms are on the call. So I will talk a little bit, extend, use some of my broadcasting traits and tricks, and then I will say the polls are closing in 3, 2, 1. And today, it's a tie. We have just as many first-time moms as we have mommy veterans. So that means I'll have a lot to say today. All right, so things we're going to cover today will include the full circle experience, which includes where we deliver. It will also include office protocols, what to expect at your visits. I'm going to give you lots of prenatal resources. We're going to go over exercise and nutrition in pregnancy and wrap up with a quick COVID-19 update. So first of all, our philosophy is based on the collaborative midwifery model, which operates under the premise that pregnancy and birth are normal life processes. It's not a disease that you've gotten that we have to cure you from. The traditional midwifery model, which is midwives only, cares for normal low risk women and then identifies abnormalities, at which point you would have to transfer out of their care for access to a physician. In the collaborative model, you're able to stay in the care of the midwife with physician direction. So we are constantly working together to go over any issues that may arrive with or arise with your pregnancy, so to speak, and make plans for you. So if you hear some plan that's going on with something that strays from the normal path in your pregnancy, that comes from the physicians. Today, actually, we just finished our maternity review. We spend 2 hours going over everyone who's 32 weeks and up and making plans for their delivery. So to that end, most of the labors and deliveries are attended by our certified nurse midwives. I know some of you came in as my GYN patient, Dr. Marrow or Mooney's GYN patient, and you're like, oh, now I'll just cross over and they'll deliver my baby. So the midwives do the normal vaginal deliveries here. But if there is something that falls outside of the scope of midwife care, they will call one of us. So urgent physician consultations are available if it's something that is emergent, like they don't have time to get one of us in there. We live about 15, 20 minutes away. They will call the hospitalists, board certified OBGYNs who are in-house 24 hours a day for true emergencies. But if it is something urgent, meaning can't wait till morning, but could wait 15 minutes, then one of us will come in and we will take the case. In terms of emergencies, last year we did almost 550 deliveries. Only 3 times did we have to use the hospitalist. And the most common emergency is that the baby is not waiting for anyone and they're not actually calling the midwife or the doctor. The baby's just coming out and the hospitalist has to catch. So please give us enough time to get there to attend your delivery. So where do we deliver? Great question. We are at HCA Florida Hospital, which is over on University. It is less than 10 minutes from our office. They are doing tours. They have one-to-one tours available. They also every quarter do a baby shower sort of situation. It's a stork tour. It's group tours. It's really cute. They raffle off prizes and things. So when you come in for your visits, you'll see on the wall the dates for the stork tours and the times to and the phone number so you can register. If those times don't work for you, still call that number and you can arrange tours. They do them in the evenings, on weekends, whatever's convenient for you and your family to walk through and see where you'll be meeting your new little one or little ones. All right, our office hours here at Full Circle are from Monday through Thursday from 9 a.m. to 1 p.m. We then close for lunch from 1 to 2. And then we reopen in the afternoon from 2 to 5 for more appointments. So if you call us between 1 and 2, you will get the after hours phone line. The phones are not broken, the phones are not down. We do that on purpose because the after hours line rings to the emergency on call provider. So if you have an emergency during that time, you will reach the person who is in the hospital physically taking care of patients. So if it's not an emergency, please don't leave a message for her. Like if you're going to be late to your 2 o'clock appointment, or you have paperwork or forms or even just a question, please call back after 2 o'clock because she will not be giving messages to the front desk. We are open on Fridays from 9 a.m. to 1 p.m. So if you call at 12:53 on a Friday with an administrative issue, we may get to it. We might not get to you until Monday. We do not have walk-in appointments. So you need to have a scheduled appointment with us. Typically, we run pretty close to full. There's a limited number of same day appointments. So if you have an issue, you're calling at 9 a.m. Hey, I really need to be seen today. If someone has a spot, we will try to slide you into that spot. If it's 9 a.m. and it's something that shouldn't wait until 3 p.m., then we're going to say, hey, that's an urgent matter. We think you need to be seen either at an urgent care or you need to go to labor and delivery to be seen. That's not us saying that we don't want to take care of you in the office. It's us saying, yeah, we agree this is something that needs to be seen. It shouldn't be sitting in our office or at home for the next 4 to 6 hours waiting for us to have a spot in the office when possibly our recommendation is going to be that you end up going to the hospital anyway. Phone calls. When you're calling the office, providers are not able to leave patient appointments to take phone calls. When you book an appointment, again, that is your time. So we are not going to leave your appointment that you scheduled and we both made time for because someone else had an issue on that same day. It's like taking walking. Don't do. When you do call, though, please be sure that you're leaving a message with the right person in order to receive a call back. And the right person is on the next screen. So if you have administrative concerns like FMLA or disability paperwork, Tony is our nurse who handles those forms. She also takes nurse phone calls. So if you're calling with questions about a pain here, urinary tract there, itching, something, Tony is the one who answers it because a lot of the same calls come in. She knows how to triage them. If it's something outside of her scope, she knows how to escalate it to the provider who is on call or not seeing patients that day. OB clinical coordinator, many of you have already had interaction with Naisha. She's the one who sends out your prenatal labs. She also makes referrals, like if you need to see the hematologist, cardiologist, high risk doctor, what have you. If at the end of pregnancy you need something scheduled, like an induction, your C-section, version, she's also that person, or circumcision for your baby. And then most people on here, I think, have also spoken with Renee Hall, who's our benefits coordinator. So she's already checked your pregnancy benefits to give you an expected out-of-pocket cost for our office, not for the facility fee, but for our office. So if anything changes with your insurance, I know this is a group that will probably be pregnant into 2025. If your insurance changes, please reach out to Renee soon, like as soon as it happens, so that we're not still collecting on an old prenatal plan that we don't need to, or if you have new responsibilities, you're not surprised by them when you deliver. All right. After hours, there is always someone on call from our practice for our practice. So that person will have heard your name multiple times in our staff meetings where we go over you, even if you hadn't had a chance to meet her. So if you are calling the after hours line, you're thinking, I might need to go to the hospital, but you do have to leave a voicemail message in order to receive a call back from her. So if you just call and hang up and call and hang up, it won't even register that a call came through. So listen to the instructions on it and let us know who you are, what you're looking for. Because remember, she is also the person who is there attending deliveries, admitting, taking care of patients. So this is for emergencies. Next question I have. I've gotten an email about getting my blood drawn to get my blood work done. Can you please tell me where I go for this? I'm a little confused on how to get it taken care of. If there was not an address and a phone number attached with the email from Naisha, then the lab slip should say where you're going to go. And it should say, if it's not that, it's usually Quest. So you would take it to your closest Quest. You can always respond to that email and ask any questions that you have because that email does come back to us. It's not an automated, it's a real person behind that email. Patient portal is another way to contact us. And please remember that those response times can take up to 2 business days. So when you are sending us a message, if it's something that can wait more than that can wait two business days, then please know that it may. If it's a non-action item, like, oh, I was just wondering if I should still take these vitamins. That's something that can wait until your next appointment. Bring the vitamins with you so we can take a look at the ingredients in real time. The portal is best used for things that have an action item between your visits, like you lost your lab slip, and you like this person who just asked this question: how do I get these labs done? That's a great portal question because it can wait 2 business days, but you'd rather have it addressed before your next appointment. Or I have COVID, so I need to cancel my appointment or convert it to a virtual appointment. Things that should not be on the portal, like urgent matters, blood pressure concerns, if you don't feel your baby move, you're having heavy bleeding, those sort of things cannot wait 2 business days. And those are a phone call to the either to the office to speak to Tony or the after hours line person, and she'll call you back and give you further direction for that. We also ask you not to send blitz messages. So remember, it's 2 business days. So if you send a message and Lauren or Dawn hasn't responded, a couple of hours later, please don't send the same message to Jane and then the same message to Dr. Mooney and to Dr. Marrow. Patients get very upset. Like, I have 5 prescriptions waiting for me at the pharmacy. Well, you contacted 5 people, and we don't check each other's messages. So it's not a great use of our time, and it makes things more confusing for you too. Also, if you are copying and pasting messages, the computer may think that you are a bot and delete your entire account or trying to spam us. And so also please don't try to have an appointment over the portal. If you have questions that are not yes, no, here's what you do, please text them to yourself so that we can have open-ended discussions at your next visit. You definitely can schedule an appointment to talk to one of us about any of those questions. Remember, the portal is like after we've seen patients all day, done all our charting, reviewed ultrasounds and labs, that's our family time. So if there's something quick that we can do to help facilitate your care before your next visit, we're happy to do it. But otherwise, the portal is like a whole other schedule after we've finished our entire schedule for the day. And so we would like to spend some time with our families if at all possible. All right. The other thing we release on the portal are your ultrasound reports. Unless there is something urgently abnormal. If there's an urgent finding, that is the one time we will unexpectedly interrupt our schedule and discuss the results. We will not let you leave the building if there's something that requires an immediate plan or referral because of something we saw on the ultrasound. Otherwise, at the end of the day, we download all the reports from the ultrasound, upload them to our electronic medical records, system and distribute them among the providers. So please give us a chance to receive the reports, review them, and release them to the portal. Typically, it's about 2 business days. If you know that your anxiety will not let you wait 2 business days to know what's on that report, I encourage you to make a regular prenatal appointment on the same day as your ultrasound. That way you can come straight from the ultrasound. The sonographer can print a preliminary report for the provider seeing you, and she can go over what the findings were prior to you getting the report on your portal. All right. Quest also has a portal. Here's the thing. They send you the results before they send them to us. That doesn't make sense, does it? No, it doesn't. Because you get the results and they have all this red all over it and it freaks you out. And then you start sending me messages and attaching the stuff from them. Red doesn't necessarily mean abnormal in pregnancy. Let me start there. The reference ranges that they use at Quest are for non-pregnant people. So the physiologic changes in pregnancy, sometimes the numbers look lower or higher, and that's normal for pregnancy. So give us a chance to receive it from Quest and review it and release it to you with our commentary. 9 times out of 10, we will address that. Now, if you've had the results for more than a week and we haven't gotten them or you haven't seen them from us, then go ahead and send us a message. Don't send the actual results because we need to close the loop from our original order. But just let us know, hey, I've had these results and I haven't heard anything, so we can request them from Quest and send them out to you. So if you've been sitting on them for a week, we really should be telling you what they are. All right, any questions on how to reach us, Labs, portals, ultrasounds. Cool. Let's move on. All right, what to expect at your visits. Expect that you are going to forget all the questions that you had when you were driving here. So start a text thread with yourself for your prenatal visits and text yourself the questions that pop up along the way. I used to get so many messages at 1 in the morning. I don't know why y'all are all up at that time, but 1 in the morning, I get a message and it's something that could wait until the next visit. But that's when the questions come up, not 10 o'clock when you have your appointment here. I don't know why. But if you have your text thread at the end of your visit, then I'll say, hey, what questions did you bring for me? Be sure you wear loose, comfortable clothing so that we can access your belly. I think we're getting out of rompers. That was a bad fashion time for OB because y'all had to get almost completely naked for us to get to your belly and listen to the baby's heartbeat. Every time you're here, we are going to take a listen to the heartbeat. So we're going to need to see your belly. We won't be doing a full ultrasound every time, but we will listen to the heartbeat every time. So we ask that you arrive a minimum of 5 minutes prior to your scheduled appointment so you'll have time to check in and handle your insurance stuff at the front desk and leave a urine sample if indicated. The American College of Obstetricians and Gynecologists no longer says that we need to check a urine routinely on everyone. Only someone that we're following for elevated blood pressures, looking for protein, or elevated blood sugars, looking for blood sugar in your urine, or if you had a recent UTI and we're checking to make sure that it's cured. You'll know, front desk will know if you need to leave a urine. Otherwise, we know you're pregnant, you've been drinking your water the whole way here, and you have to go to the bathroom. So once you come in, just head straight over to the bathroom, and that's fine. You don't need to leave us a sample routinely. If you're 10 minutes late for the visit, we'll have time to check on you and your baby. That does leave us less time for our text thread questions. But if you are 20 minutes late, you have missed the whole appointment. And so we may be able to work you in later in the day if there's an opening on someone else's schedule. But if you're not able to stay for that, then we'll just reschedule to a time that is mutually convenient for both parties. If there's something going on like car accidents and everyone is, 15 minutes late, like we're not barbarians. We understand that things happen, things like that. But if the next patient behind you is on time or early for her appointment, we want to be respectful of her time as well. Diagnostic ultrasound visits. So the next question I get is, well, when's the next time I'm going to get to see the baby? Great question. So diagnostic ultrasound appointments are separate from prenatal visits. So remember you came in and you saw the sonographer and then you saw a provider who went over the ultrasound with you when you had your confirmation. Diagnostic ultrasounds are the same way. And if we go back to that slide, you will see that you'll know if you have one coming up if you have more than one appointment time and if there's a provider's name associated with your visit. So when you log into your portal, you'll see this is Tina Test, my imaginary patient. And Tina clicks on appointments and then she sees that she has 2 appointments on the same day. So the first appointment is at 9:20 with ultrasound, which is not a provider's name. And the next appointment is at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina knows she has an ultrasound that day and she can get her preliminary results with Dr. Yeckel later on. So she can tell her family, hey, join me at 9:20. You guys need to take off before the appointment. That's fine. Or you're welcome to stay and listen to Dr. Yeckel's review of it. Question I have out here is when can we find out the gender if we do not do the genetic testing? Great question that I'm going to answer in just a little bit. Hang on. Next slide. There we go. The results are sent to the portal within 2 business days. Unless there is something urgently abnormal, as I discussed, that we will not let you leave the building if there's something that needs an action plan that day. So when you're checking out from a regular visit, when you're at front desk, let them know you need a prenatal visit and an ultrasound. So if Jean says, hey, it's time for your next ultrasound, you go up there and they only schedule you with Missy. Missy does not do ultrasounds. They need to schedule you with an ultrasound tech as well. Now, if you need to see the baby more than we medically need to see the baby, then there are boutique ultrasounds. So to answer the person who just asked that question, boutique ultrasounds are cute little fun ones that you can do as early as 14 weeks. Some of them have sneak peek, well, that's the name of one of the places, but they have reveal packages that they do as early as 14 or 15 weeks. And then they also have 3D things and they give you the little stuffed animals with the baby's heartbeat in it. It's really cute. So these are just a couple that are around town, again, for informational purposes, not endorsing any one specific specific provider over another. And there is another one, I think, down in St. Augustine too, that I don't have listed on here, and actually a couple more probably, but just to get you started. So that's the answer to the person there. If you did not do the genetic screening that tells you the baby's sex, you can do one of these reveal packages at the boutique ultrasound. See, I was just getting ready to answer you. Next question I have is, does your office do the anatomy scan? And actually, that poll question is going to answer your question. When should you expect routine ultrasounds? Your choices are, do we do ultrasounds at every visit, which I've already answered? Do we do them at 20, 40, and 41 plus weeks, or do we only do ultrasounds if you have a problem? And you will have just a few more seconds. Polls are closing in 3, 2, 1. So the middle answer is correct. So at 20 weeks is when we do anatomy ultrasounds. So to answer your question, yes, we do anatomy ultrasounds here in our office at 20 weeks. Routinely, if everything is seen and everything looks normal and you continue to not have any other issues with your pregnancy, we would not need to do another medical ultrasound until after you pass your due date. If there's something that we didn't see or there's something abnormal we need to follow, then you would have additional ultrasounds. So routine ultrasounds, anatomy at 20 weeks, and then post-dates testing if you pass your due date. All right. Y'all have crystal balls. You're asking questions like 2 slides before I answer them. All right, we're headed to Full Circle Jacks, our website, fullcirclejacks.com. Lots of resources out here. Those of you who were with us when we were at Ascension in 2023, we moved in October, and have questions about us moving to HCA. There was a town hall that I held in October, and you can watch the replay if you click on the here in that banner up at the top. Otherwise, we're going to scroll down to providers and give you an idea of who will be attending your delivery. So we all rotate call evenly, so we do not know who is going to be on call when your baby decides it's his, her, or their time to join us. So we have the physicians here. So there is me, there's Dr. Marrow, there's Dr. Yeckel, and there's Dr. Mooney. And then we have the midwives. So the midwives rotate first call. There's Lauren, there's Krista, there's Cindy, there's Dawn, there's Missy, and there's Jane. And one of them will be there when your baby decides to come hang out. All right. You can click on our bios to learn a little bit more about each of us too. But I think the most important thing is that we're all doing our most favorite thing in the world to do, and that's helping you grow your family. So clicking here on patient information, you'll see the obstetrics tab, and you'll know you're in the right place because you'll see all the bellies, and at the end, you'll see the baby. Our delivery stats, which are the reason that many of you are here with us. So how many C-sections, how many first-time mom C-sections, how many VBACs, all of those things are listed here back to 2018, because that was the year Dr. Marrow joined us and started helping me keep better track of my stats, and she's amazing. Then our prenatal care timeline. So we're going to click on that so you'll know what to expect at each visit. And I have a couple questions here. So as that loads, I will see what these questions are. First one is, will we rotate seeing every provider before delivery? So our preference is for you to meet everyone before delivery. Some people don't get a chance to do it. Some people prefer to see 1 or 2 people. When they do I prefer to see this person, we just let them know, hey, just know this person may not be the one who's on call, so you may be delivering with someone who you've never met. Like, our preference is for you to see everyone at least once. The next question is, I don't want to deliver on my back. Is there any nature room available? Hang on for a moment because I will be answering that soon. We can read that one. And do we still rotate providers at appointments to meet as much staff as we can? And that is the goal, to meet as many people as you can. Everybody here is very nice. If you look at the reviews, a lot of people will say, I never even got a chance to meet Lauren. Usually it's Lauren because she's the part-time person. And I had an amazing experience. So I guarantee your experience but if you want to just see all of our faces ahead of time, you're definitely welcome to request anybody who you haven't seen. So this is our prenatal care timeline. This is what to expect at each visit. So everyone on here has already had their confirmation visit, which we prefer to do between 8 and 10 weeks. At that visit, you met with Renee, our benefits coordinator, and you got your due date assigned. And then they told you you'd be meeting with me here and doing a virtual visit with me. So when you do your virtual visit with me, you will receive instructions on how to join the morning of the call. And at that appointment, we're going to go over your medical history and if applicable, your pregnancy history to let me know which labs we need to order. You'll also tell me whether you plan to do genetic testing. Then you'll receive an email from my OB coordinator explaining with the lab slip for you to take and have done before your next appointment. At this point, we're seeing you every 4 weeks in the pregnancy. So about 4 weeks after your confirmation, you'll be back in the office to have a physical exam. The labs that we routinely order are listed on here. We have lab transparency here, so you never have to wonder, well, what are they drawing? It's all right here. Those are the standard labs from the ACOG panel. In addition to those labs, cervical cultures are part of the ACOG screening panel as well. The pap test is not. If you are due for a pap test, though, you're welcome to have it done when we're doing your cervical cultures, but it's not a required part of it. You can definitely postpone that till after pregnancy. Then we'll see you about 4 weeks later to do a second trimester check and just see what's going on with baby. Talk about how your body will be changing during this time when you start feeling flutters and kicks. It's an exciting time. And then right around 20 weeks is when we do your anatomy ultrasound. So you'll see there in the middle too, mental health screen. So that's routine for everyone. So we're not singling anybody out when you get a depression screen or an anxiety screen. Pregnancy has its own emotional ebbs and flows, and we want to make sure that we're getting ahead of keeping you in the best mental health that we can as well, because happy mommy, happy baby. And then 4 weeks later is when we do the glucose testing. So I know I'll have some questions about that. Hang on to them because I'm going to do a whole section on the glucose testing in just a little bit. My moms who have a certain type of blood, Rh negative, if we don't know either dad's blood type or baby's blood type from the early genetic testing, we'll make sure that we get ROGAM injection ready for you for administration between 28 and 30 weeks. If you're planning to work with a doula, we'll talk about doulas a little bit later in the call as well. You want to get her secured then, get your hospital tour under your belt, and then you'll see here in the third trimester in the middle, option to repeat or decline your standard prenatal labs. So ACOG recommends doing them at least once. Duval County Health Department recommends repeating them in third trimester. So if you agree and want to do that, we're happy to get those drawn for you as well. You'll see the vaccines over there listed on the right side. We don't do those in the office. If you want to get them done, we can write prescriptions for you, but we typically would refer you back to your primary or minute clinic. And then we start seeing you every 2 weeks. Starts getting real. So every 2 weeks, my moms who may have developed some other issues with their pregnancy may require additional testing, which starts at 32 weeks. My moms who are having a belly birth, which is our term for the C-section, we try to start getting your date on the calendar right around 33, 34 weeks or so. And then the every 2 weeks visits continue until you're about 36 weeks. At 36 weeks, we do one more pelvic exam to screen for group beta strep, and we'll explain what that is and why it's important at that visit. And if you've already opted out of third trimester repeat STI screening, then you've opted out of repeating your cervical cultures. This is when we start seeing you weekly. So your full term, yay, 37 weeks. You can bring in your birth plan because you're no longer preterm. And so a lot of the birth plan things are on the table now. Start your natural cervical ripening methods. For most moms, unless there's a different indication, a repeat cesarean delivery is usually performed around 39 weeks. For those who are waiting for labor to happen, to start naturally, we wait. We wait. Babies don't have calendars, but they also don't have an idea about safety. And so we want everyone safely out by 42 weeks. So first time moms, 41 weeks and 5 days is when we would want to start an induction. For second time moms, 41 weeks and 6 days. While we go back to the original thing, we will take a look at the questions. First one is, are water births supported? We have water labor. We have hydrotherapy, which I'm actually going to talk about in just a minute when we get to birth preferences. And then the next question is, what is the cutoff for when midwives can deliver? It's as long as you're able to have a vaginal delivery, you can have a vaginal delivery with the midwife. And the next question is, will you give us paperwork to help us make our birth plan? If you stay tuned, yes, I will. Just a moment. All right, my next poll question is, I like this. You guys are really involved. Good questions. Pregnancy safe medication. So, if you have a headache during pregnancy, are the people on this call more likely to meditate until it goes away, take a Tylenol, or go to the emergency room because I've never had a headache before? What is this? And the polls are closing in three, two, one, closed. All right. So pretty even with the first time moms and veteran moms, the meditators and the medicators. Thankfully, no evacuators. No one's going to the emergency room. All right, I'm more of a medicator than a meditator on most days. So many of you have already talked to about things like constipation and sweatiness and fatigue and gassiness and all those really sexy things nobody ever associated with pregnancy. Well, guess what? They are real. And here is a list of common pregnancy discomforts alphabetized. So in the middle there, you'll see the relief measures. So these are the things that we want you to try first. The interventions and lifestyle changes that we want you to try before you go to anything that's medical. The things that are on the right side are when you've exhausted all the relief measures and nothing is working and you need to take a trip to Walgreens or CVS. We also have some caveats on there, so things that we'd like for you to avoid. And then you'll see that this list kind of goes on through the next page. So, cough, cold, sore throat, like we're having a resurgence of COVID again. So that's why we're going to go through the thing at the end. But just remember, all the things are out here for that as well. And if you're having nausea and vomiting and you can't keep any fluids down for 24 hours, please call us because we're probably going to want you to come in, not to the office necessarily, but to the hospital for IV hydration. So just remember that this is out there. You can download it to your phone. You can print it out if you're old school and put it on the fridge. But all of these are good and up to date recommendations. And if there is a name brand on here, like Tylenol cold products, any of the Tylenol cold products are fine as long as they don't contain any of the things that we say avoid, like pseudoephedrine. Gestational diabetes screening test is our next block. We're not going to click on this one right now, but I promise I am coming back to gestational diabetes screening. But just remember that this box is out here. So next we have weight gain in pregnancy, because another thing that I have heard is that some of you are very concerned that you have not gained any weight yet, or some of you are very concerned that you've already gained a lot of weight in this just first trimester. So how to know how much weight to gain. So there's a link here that you can click on and it will ask you for your pre-pregnancy height and weight. And once you put those in, it'll give you your pre-pregnancy body mass index, and based on that, gives you what your recommended weight gain is in pregnancy. But you'll see there in the last column, the rates of weight gain are in your second and third trimester per week. So if you haven't gained anything in your first trimester, don't freak out. Your baby is still getting bigger, most likely because he, she, or they are taking something from you. So as long as you are taking your vitamins, staying hydrated in your first trimester, your baby is still growing. You will see yourself start to put on weight in your second and third trimester. Don't worry, it's coming. That appetite will definitely come back. All right. As we go back then, the next thing that you'll see is birth preferences. So the person who just asked me, will you give us something so that we can help to make a birth plan? Boom, here you go. All right, birth preferences. This is our template for a birth plan. So it covers a lot of things, everything from how and when you would want labor to start, to what you wear in the hospital, how you want to be monitored, what you want to do for relief of your discomfort. Some of the things to note on here are that we don't strap you to the bed and starve you. Our goal is for you to be able to move around. You can labor in any position. Some of the rate limiting factors are sometimes blood pressure, bleeding, or baby's heartbeat. If all of those things are fine, you meet criteria. We want you and baby to be active participants in labor. So you can push in any position, you can deliver in any position. Our standard is perineal massage, warm compresses to the perineum, slow delivery, delayed cord clamping, immediate skin to skin, like all those things. But if you need or want something different, like if you're doing cord blood banking, stem cell banking, delayed cord clamping until the cord stops pulsing, obviously is not compatible with that. So please check off the things that are salient to you, bring them in after 37 weeks, and we'll kind of go over it to see what everything's going to look like for you. We'll also have listed on here different things you can do with your placenta, the routine medications that are offered to your newborn. Recommend coming in and just talking to the midwives about what each of those medications are. Would they apply to you? All of those things. If you plan to have your little guy circumcised, If you're having twins, and then if you're expecting a belly birth, we do a procedure termed the gentle or family-centered cesarean. And so there are a lot of boxes on here, 21 boxes, but all of them don't apply to you. So just take a look at all of them and take your time, take one box per week, and then bring it in and have a conversation with one of the midwives at your visit about what to expect at delivery. Cervical ripening techniques. So when you are ready for this little one to come out, the midwives will probably say, hey, have you looked at the cervical ripening stuff on our website? This is what she's talking about. So there are things you can do as early as 20 weeks, raspberry leaf tea, and drinking it as it says there. And then at 36 weeks is when it really kicks up, like I said, on what to expect week by week for your prenatals. So 37, 39, acupuncture, acupressure, evening primrose, dates, all that good stuff. So you can just read on here line by line what's in there. But the one thing that is not on there is castor oil. And please definitely make it a point to ask your midwife why castor oil is not included on this list. All right, so we'll go back, and the next box that you'll see is for first-time moms in trial of labor after cesarean. So is there any mom on here who has had a C-section before and is going for a vaginal birth after cesarean? And here there are only two answers, either yes, and you're going to rock it, or it doesn't apply to you. Oh my gosh, I believe this is the first call I've ever done where there are no VBAC mamas on the line. Holy cow. All right, well, first time mamas, you listen up because this is for you, because you and those VBAC mamas were doing the exact same thing. Your success is our goal. Our goal is to prevent the first C-section to stop the cascade of C-sections many years down the line as well. Babies are going to baby. You cannot control what the baby is going to do, but control what you can. So if you're already seeing a chiropractor, fantastic. Be sure he or she is Webster certified, which we'll talk about a little bit later. Pregnancy yoga or Pilates, which we'll also talk about. Method-specific childbirth courses. The biggest thing that gets to first-time mamas is impatience. The average length of your labor is 24 hours once you kick into real active labor. So your biggest enemy is coming to the hospital too early, getting medications too early, and giving up or being tired of being pregnant when you're 38 weeks and saying, can you induce me next week? Daily squats to open up the pelvis, gaining only the recommended amount of weight, having a doula. Please don't cheap out on the doula first time mamas. Your best good girlfriend who's always wanted to be at a delivery but has never seen labor before, she can come and visit, but don't have her be the person supporting you in labor. You need somebody who can help you get into the right positions. Speaking of positions, spinningbabies.com is an excellent resource to find exercises for baby's position. I'm spending extra time on this because I have a lot of first-time moms on the line, and the most common reason we are doing C-sections these days is not baby's too big or baby's in distress. It is baby is malpositioned, little crooked head that's leaning off to the side this way, or the head is down, but it's sunny side up, and we need baby to rotate during labor. So avoiding non-medical inductions and then trusting your body and trusting us. We have the same goal. So if we're recommending doing something a certain way, it's because it's going to give you the best chance at the vaginal delivery that you want. Trust us. I don't want you messing up my stats. I've worked many years to get these stats. All right. Please and thank you. All right. Last thing on here is circumcision care. So if you're having a son and you'd like to have him circumcised, we do those in the office, not at the hospital, in the office before he is 10 days old. Just let us know when he's born, and Naisha, my OB coordinator, will send you a portal message within a day or so with his little appointment time, and be sure he's on time. We give babies the same grace period we give y'all. They don't have watches yet. All right, we're headed back to the regular presentation, and we're going to start to talk about nutrition. So for those who are concerned about your weight gain so far when all you're drinking is coffee, my question is, are you, or are you drinking coffee? A salted caramel mocha. So good, so good, so bad. Did you know pregnancy only requires an additional 300 calories per day, and it takes 10 kilocalories to maintain a pound? The amount of weight you gain in pregnancy, again, is based on your starting body mass index in pregnancy. So if you're starting the pregnancy at 170 pounds, it takes 1,700 net calories to maintain that. If your goal weight gain is 25 pounds, that's 250 additional calories for a total daily caloric intake of 1,950. If we divide that between breakfast, lunch, and dinner, that's 650 total calories per meal. So If you drink 570 calories, then that doesn't leave you very much to be able to eat on that day. So we can make some simple changes that will help us to keep our sodium, our fat, our carbohydrates at a manageable level. This is a very busy slide, but a great slide to go back and review later on. Just looking at certain things, I had the spaghetti sauce on here because y'all always reach out in the third trimester. My rings don't fit, Dr. A. And the first thing I ask is, what did you have last night? It's Chinese food. Mhm. So also, you can make little changes from traditional spaghetti sauce to marinara and cut out about 500 milligrams of sodium. And then this also gives you some good information on how to balance carbohydrates and protein. We're going to talk about protein intake in just a while. So things you should be eating. What should you be eating? Fruits, veggies, whole grains, cereal. You're not going to give your baby an allergy to nuts or dairy if you eat them during pregnancy. So enjoy. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily, remembering that 200 milligrams is still a good amount of caffeine. That's like 3 or 4 tall coffees. And caffeine late in third trimester can cause abnormalities in baby's heart rate. So if you are drinking caffeine, do it with the 3-to-1 rule. Take in 3 times as much water as caffeine because it is also a diuretic. Herbal teas are fine. Our favorites in pregnancy are raspberry leaf, as I mentioned before, ginger, lemon, and peppermint. For my vegetarians, vegans, you want to still have protein in the amount of 70 grams. There are some pregnancy diets out there that tell you you need 120 grams of protein a day. Please don't do that because you're going to grow like a 10 or 11 pound baby, and just don't do that to either of us. All right. We have the same goal here. Remember, and 11-pound babies tend to wreck those goals and other things. So 70 grams of protein is very reasonable to support a mom throughout pregnancy. Also, you can have deli meat. Yes, you can, as long as you microwave it for 30 seconds to be sure you kill any harmful bacteria. If your cheeses, the soft cheeses, are made with pasteurized milk, you're fine. If you can't flip it over, like you're at a restaurant and you're like, I don't know if this is pasteurized or not, just skip the soft cheese for that night. Canned tuna, you can have 3 4-ounce cans per week. If you're a pescatarian and you're like, I need more than tuna, here's a wonderful document from the FDA on how much tuna and everything else you can eat. So this is a great document about eating fish. It says October 2021, but that is the most recent update for this. Fish you should be eating a lot of because they're high in DHA, things you should stay away from because of methyl mercuries, and things you should eat in moderation. Good fish, good fish. Things you want to stay away from are undercooked fish, undercooked meats. So yummy ahi tuna is not on your menu for a bit. Medium well steaks, medium rare steaks are not on your menu. Sorry, you will need to ruin your steaks for the next 6 months and have them well done. For my kombucha drinkers, my kimchi eaters, those are fermented beverage and foods. You want to limit those as well, if not cut them out completely, because your body treats them as a fermented thing like alcohol. And we don't know how similar the effects are to alcohol, which we don't recommend at all because we don't know how much is safe in pregnancy. So we can't say any amount is. Sodium, you want to limit it to 1,500 milligrams per day. And once you start flipping your food over and looking at the sodium, you will be appalled at how little 1,500 milligrams is compared to how much we put into everything that we eat. All right, any questions on food before we move on to exercise? All right, not a crowd of foodies. Okay, moving on. Exercise. It is just fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. You just won't feel like it very much in your first trimester. So, second trimester, you'll have some physiologic changes that will accommodate more activity. Your blood volume increases by 50%, which increases your oxygen tensions and oxygen saturation. And so you'll be able to do more of that aerobic activity that makes you feel good, releases your endorphins. Just listen to your body, though. It will come back. You will return to being the Olympian athlete you were prior to pregnancy. Now, if your Olympic sport was couch sitting before, then we're going to make some changes here in the second trimester. So it is okay for you to start a new regimen. It doesn't have to be anything crazy, just getting up and moving around for circulation and getting baby in the right position. So starting a new regimen, which I think is on the next slide, will help us because sedentary lifestyles again lead to malpositioned babies. So those of you who are working from home, sitting in these slouch chairs like this all day in front of the computer, are encouraging your babies to settle into the sunny side up position, which only about 5% of women will deliver vaginally with that. So first time mamas, that is a huge red flag for us. We need you to sit on the birth balls to get our posture straight up so the baby will descend in the pelvis face down, head down, and face down. Those of you with these cute little Fitbit watches who are creating a new source of anxiety because you're consistently monitoring your heart rate, it is normal for your resting heart rate to go up 10 to 20 beats per minute. As long as you're not feeling lightheaded or dizzy or like your heart is actually racing, that is fine. That's a normal physiologic change of pregnancy. Next question I have up here is sauerkraut. I meant to add that too because somebody asked me that last time. It is actually a fermented thing too. Yep, sorry. The kraut is not great either in large quantities. Limit severely. Aerobic zone. Oh, some of you are saying, oh, I do exercise, Dr. A. I walk. So walking can be considered exercise if when you walk, your heart rate is in the aerobic zone. Your aerobic zone is 70% of your maximum heart rate. Your max heart rate is 220 minus your age. So if you start with 220, let's say you're 30 years old, we subtract 30, your max heart rate is 190. So you should not be exercising at sustained heart rate higher than 190 for extended periods of time. Your aerobic zone, though, starts at 70% of that, so 133. So if when you're walking, your heart rate is between 133 and 190 sustained for 30 minutes, 3 times a week, then walking is exercise. Otherwise, if you're like, well, I walk from my desk to the copier, to the vending machine, and back to my desk, and your heart rate is still hanging out at like 87, then your walking is transportation, and we can find a different thing for exercise. Question I have here. I've worked out my whole life. However, this first trimester has kicked my butt and I've been laying in bed for 11 weeks. It sounds like I will bounce back once in the second trimester. Do I have anything to worry about because I've been so inactive in the last 10 weeks? I'm very nervous. No, just listen to your body. Like, don't start out trying to go right back to the whatever explosive thing that you were doing when you got pregnant. Just slowly work your way back up to it. Your body will tell you when it's time to sit down. And when your body tells you, just listen. So things that you want that are okay for you to do. If you love cardio, it's again fine to go right back to that. Treadmill, absolutely. Elliptical, yes. Swimming, definitely. Swimming is actually my favorite in pregnancy because your belly is weightless, your joints, you don't have that resistance, and you get a full aerobic workout with it. And you guys are pregnant in the summer. This is the one advantage of being pregnant in the summer. So please take it. Indoor bike, absolutely. If you have a Peloton, my leaderboard name is Off My Meds 8. So if you follow, I will follow back and we will keep each other honest. If you were lifting weights prior to pregnancy, it's okay for you to lift up to whatever amount you were lifting pre-pregnancy. You don't need to add resistance during the pregnancy because your baby and your body are going to be adding weight. If you were already squatting prior to pregnancy, please go right ahead. I love squats. They are my favorite. If you were not squatting before pregnancy, now's a great time to start. So build up to 50 squats a day. You want to start at 20 weeks by giving me 5 a day. 21 weeks, give me 10 a day. And I mean deep squats. I have been known to show up in labor rooms at times and do a squat quiz and squat with people when they're in labor. But that really helps to descend that baby into the pelvis. Anything that makes those muscles long and lean, like pregnancy Pilates, pregnancy yoga, and any experienced instructor will be able to tell you what the pregnancy modifications are for those things, which I think you guys are seeing. There we go. All right, things that you want to stay away from, we'll get to in just a moment. Do cured meats also need to be heated before eating? Yes. Prosciutto was the example given here, which sounds delicious. Yes, definitely microwave that for 30 seconds. High intensity interval training after first trimester, it's not the intervals, it's the intensity. So you can do the low impact version of whatever HIIT workout you were doing before. Anything having you lying on your back for extended periods of time, like ab work. So you can do side lying abs, you can do standing abs, but just not abs flat on your back. And hot yoga, unless you're a hot yoga instructor and are fully acclimated to that environment, then we want you to avoid that. Regular yoga is fine. We also want you to avoid scuba because of decrease in barometric pressure and decrease oxygen to the baby. Same thing with high altitude hiking. You're fine for altitudes up to 8 to 9,000. Above 10,000, we'd like you to not do that. So you can go visit your family in Colorado, just don't go hiking with them and requiring more and more oxygen. Contact sports, want to stay away from fast moving things where you can roll your ankle, not because that's dangerous to the baby, but because you can't get any of the really good pain meds during this time if that happens. And, tennis, anything that has balls flying at your belly at high speeds, just kickboxing, just please don't. And then outdoor biking after 16 weeks is not a definite no, but it's just a beware because that is when your center of gravity changes. And as you have to turn corners, you may find yourself getting pulled over to one side. And I don't want you falling off of your bike if we can avoid that. Next question I have is, do I need to make sure I'm not sleeping on my back? Hang on, cliffhanger. I'm going to answer that in just a moment. All right, I believe I have a poll question now. I do. All right, so now that we've talked about diet and we've talked about exercise, can you prevent gestational diabetes with diet and exercise? My veteran moms know me very well. I'm going to answer this question right. We're going to close the polls in 3, 2, 1. Boom. All right. Man, veteran mamas. Okay, so no, the answer is no. You can't prevent gestational diabetes with diet and exercise. You can manage it, but you can't stop yourself from getting it. So the reason why is why we screen everyone. So your number one risk factor for gestational diabetes is your placenta. Did you know gestational diabetes is just your reaction to hormones given off by your placenta? The placenta gives off hormones all along pregnancy, but after 24 weeks, it gives off more and more of a hormone that makes your insulin less and less effective. Insulin's job is to clear your bloodstream of glucose. And so if your insulin is not doing its job, then you have all this excess circulating glucose out there, which is diabetes. That's gestational diabetes because it's caused by your placenta. So if you don't have a placenta, then I don't need to screen you for gestational diabetes. But once you get a placenta, I have to screen you. So for my moms who say, but I never eat anything with sugar in it, don't avoid your good carbs prior to the test. You do eat fruit, you eat whole grains. Don't avoid those things because you're going to actually throw your body into a state of confusion when you have your glucose challenge. If it's the drink itself, like the ingredients in the drink that bother you, we do have several options for glucose testing. So we do have the Simply Pure drink available for sale here at the office. It is soy-free, it is dye-free, it is gluten-free, it does not have BVO. It is kosher, it is vegan, it's offensive to almost no one. We also have additional patient-driven options that are on our website. So if anyone has heard of Glucorganics or Fresh Test, those are acceptable options. And there are glucose tablets as well that are available on Amazon. So remember that little block that we didn't click on the website? If you click on that, it has all the instructions of what to do on the day of, like when to stop eating, what to not eat before the test, and it has links to all of the different options for glucose testing. And the next question, if you didn't have gestational diabetes in first pregnancy, are you more likely to not have it in your second pregnancy, or does it not matter at all? So actually age is another risk factor. So you're older now than you were in your last pregnancy, so you're more likely to have it in a second pregnancy than you are in a first. Next question, is the glucose screening done at Quest? Yes, it is. It is. Now, if you're planning, that's a great question too, because if you're planning to use one of those alternative things that you purchase, Quest does not accept outside drinks, and so we will need to send you to LabCorp. So if you're planning to use those, it says all this on that paper that's on the website. You're planning to use one of those, tell your midwife so that she can write it on there, patient bringing outside drink, and we'll order it from LabCorp. Okay, method classes. For those of you who are either just trying to hold off on the epidural or pain medicine or trying for an unmedicated delivery, we recommend childbirth education classes, method classes that teach you about breathing and stages and phases of labor. So included on here are things like hypnobirthing, hypnobabies, Lamaze. I think Bradley is on here too as well. I think so. But again, these are for informational purposes. There's lots of information out there about people who support different classes, child with education classes. But first time mamas, if you're planning an unmedicated delivery, it's like running a marathon. You don't wake up one day and decide to run 26 miles, 26.1. You train for it. So please take some sort of method class so that you are prepared for this. We're here to encourage you. The encouragement starts today. All right, next. Breastfeeding classes, when you talk to the midwives, usually around 20 weeks is when they'll give you information about that. There is actually a free breastfeeding class. It's getting ready to start at Full Circle. So if you're following us on Instagram, we were tagged in a post recently, so you'll be able to get more information about that. And that will happen in cycles coming up. I'm super excited about it. Every new parent should know CPR. If you already know CPR and you're like, oh, I'll just do it with one finger because it's a small person. No, infant ratios are different. So please take a new refresher CPR class to learn infant and child CPR. Here's a link to the Red Cross. And then I mentioned before, if you're already seeing a chiropractor, be sure he or she is Webster certified, which is a special pregnancy certification that changes how they do adjustments to how pregnancy changes your body so that the adjustments are safe for baby and don't encourage baby to settle into a malposition and increase your risk for C-section. We want the opposite thing. All right, one more poll question. How many, actually I have a couple, but how many people here are planning on working with a doula? All right. I know some of you, when I talked to you, you were considering it, but you weren't really sure. So if you're not sure what a doula is, hang on. I'm going to tell you in 3, 2, 1. Oh my gosh, what is this amazing group with all these people who are planning to work with a doula? Fantastic. Okay, so let's talk about doulas then, because there were quite a few who said that they were unsure of what a doula is. All right, so doulas are there for physical and emotional support. So they provide that support before, during, and after pregnancy. So they help you with your breathing. So if you've taken a method class, when that first contraction hits, it's the Mike Tyson quote, everybody's got a plan until they get punched in the face. That doula is there to remind you when you get punched in the face, okay, here's how I breathe through this. Here's a position I can get into. So position changes, relaxation strategies during labor. Your doula is part of your birth team. They are not part of your clinical team. So they are the ones to help you process your feelings about recommendations from your medical team, the midwives and physicians. They are not giving you the medical advice. They're helping you to have more questions about what advice you're given and how does that impact your birth plan. They're not going to prescribe medications for you. They're not going to deliver the baby. I mean, unless you don't tell us that you're coming to the hospital and you do it in the car. But so please don't do that. Please come on into the hospital so that we can do what you pay us to do. But they are considered part of your birthing team, even though they are not clinicians. And so you are their clients and our patients. The best doulas that we've seen are the ones who are with you, and from when labor starts, they come to your house, they walk around with you, they help you get out of the tub and stuff. Some of them even come to some prenatal visits with you to go through the birth plan with the providers. So if you're not sure about who you're going to use, ask your midwife. They have, no shortage of opinions on recommendations for the doulas who they've seen support our patients through the years. Acupuncture in pregnancy can help with nausea in the beginning, discomfort in the middle, and baby's position at the end, and even baby come out like cervical ripening at the end. Pregnancy massage is fine too. Most places won't do it in first trimester because there's an increased risk independently of miscarriage, and they don't want to be associated with that. If some places require a letter, we do have a standard pregnancy massage letter that we can email to you that you can take to your thing. Question here I have is, would it make sense for my mom to be my doula? If your mom has been in multiple births and your mom has some like physical therapy or massage training or something that can help babies to get in proper positions, and if your mom, like if you and your mom get along great, yes. But in labor, people who we normally love a lot can be annoying, and so if y'all have a lot of friction, that's not good doula energy. Wonderful for your mom to be there, but then also consider, would she want to be working that whole time, or does she just want to be Nana and be your mama and just watch her baby too and not have to be considering hip squeezes and squats and all of these things, or just kind of being there and giving you a hug when you need it. I usually say go for an experienced trained doula. All right, next. Breast pumps. Many of your insurances do cover breast pumps. We have a QR code in all of the exam rooms. So around the time that you get your ultrasound done, scan our QR code, fill in your information there. They will check your insurance, send you which breast pumps are covered by your insurance. You check, check, check. They create a prescription, send it to us. Bada bing. It's super easy. Please don't go find your own company that provides breast pumps. They send us 5 or 6 pages asking for questions back to when your first visit, it's such a hassle. We found a company that does it very easily and efficiently, and you'll have your breast pump in like 2 weeks. So please scan our QR codes. We don't get a kickback from it except our time. So please get your QR codes from them. Lead Guru is a third-party vendor that we've been working with recently for FMLA and maternity specifically. So if you need intermittent leave to attend your visits, if you get a diagnosis like gestational diabetes or hypertension and you need more testing, and so you're taking more time off of work, intermittent leave for that, or when you're ready to take your 6 to 12 weeks off after baby is born, we've been using Lead Guru because those of you who are with us for babies before or with other offices, the standard turnaround time for most offices is about 10 business days. Lead Guru usually gets your forms done in less than 24 hours. So when you're ready for your FMLA, not disability, but FMLA, please contact our office and we'll give you details on how to get set up with our third-party vendor. Postpartum care, because one day you won't be pregnant. My moms who had issues with blood pressure, we see you back afterward, usually about a week or so after you deliver, to make sure that the blood pressures are still staying down, because your most dangerous time for preeclampsia is the first 14 days after you deliver. If you had a belly birth, you'll come back in about 2 weeks for your incision check, and everyone gets routine mental health screening. Postpartum doulas are a thing. I mean, if they're there for emotional and physical support, when do you need it more than when you've just had a baby? The Motherhood Space is a phenomenal resource available here in Jacksonville. There is a grant given for YMCA partner with Baptist Hospital. They do daily therapy, 3-hour blocks with dedicated childcare that's billed to your insurance, covered. It's free of cost. And it's an amazing resource for those at high risk for postpartum anxiety and depression. And then pelvic floor therapy, which is standard of care in many parts of Europe, we do offer here in our office after delivery, Tuesdays, Wednesdays, and Thursdays. We have a nurse who comes in dedicated to putting things back where we found them prior to the baby doing stuff to get them out of place. All right. To answer your question, yes, you can sleep on either side. You can sleep on your right side. You can sleep on your left side. You can sleep on your back. If it freaks you out to sleep on your back, or if you wake up like feeling a bit breathless or dizzy, you can buy one of those wedge pillows from Amazon, stick it under one hip, and that will help you to not roll completely onto your back. You can help paint the nursery as long as you are in a well-ventilated area and wearing your mask. You can take probiotics. You can dye your hair, including your eyebrows. You can do gel nails. If you're sitting in a salon with a lot of fumes, though, you may want to wear a mask just so you don't get dizzy or sick. You can travel in cars. Travel is okay up to 37 weeks. After that, you don't want to be like your full term. Don't be far away from us or some stranger's going to deliver your baby. Just want to make sure you're getting out and stretching every 2 hours of a long car ride. Flight is also okay up to 32 weeks for my twins, 36 weeks for my singleton moms. Just be sure you are wearing compression hoses, drinking lots of water, and doing those toe raises to prevent blood clots when you're in the air. Skincare, you can use your salicylic acid, your benzoyl peroxide, most of your topical things except for things that have retinol in them. If you need to use something that's similar to retinol without the harmful effects on the fetus, bakuchiol, Bakuchiol is an alternative that you'll find in many natural products that's fine for that. You want to stay away from roller coasters and water slides. So the no risk list is very short. Next question I have is, should I take my prenatals through my whole pregnancy? Yes, and throughout the whole time that you are breastfeeding as well. Remember, the prenatals are for you. Baby is going to take whatever nutrients he, she, or they need from you, and then you will be left depleted. So the prenatal vitamins keep you stocked up so that baby doesn't have to drain everything you have. They will drain your wallet later. I have teenagers. All right, COVID-19 updates. This is going to be quick and then we're done. ACOG moved from supporting either way to strongly recommending it based on a New England Journal study of 35,000. patients in April 2021. Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because of its independent risk for blood clots. So if you need a booster, the best time to do them is in the third trimester because your antibodies will be at a high place, like the same time that we did Tdap and those things. I think we'll be back into RSV season by the time we're in the winter with you guys. So all the vaccines were approved for boosters 6 months past your Moderna or Pfizer. If you're 2 months past your Johnson and Johnson, you can get another one, but not Johnson and Johnson. So you can mix and match and get Moderna or Pfizer. And again, we don't do those here in the office, but we can write prescriptions or refer you back to your primary or one of the outpatient clinics at pharmacies. Next. If you do contract COVID, because again, it's going back around now, if you are at the hospital anytime soon, you will see the nurses wearing their masks again on the unit because it is back in the hospital. It's not required for everyone else, but you'll see it because it is happening again. There are no formal recommendations for ivermectin, azithromycin, or Plaquenil. What we do recommend is the vitamins that you see here in the recommended doses that you see on here. We also recommend that you start a baby aspirin, the little 81 milligram chewable ones, until 36 weeks. If you get COVID after 36 weeks, like your full term, don't start the aspirin. You'll increase your risk of bleeding at delivery. But prior to that, you'll decrease your risk of the gestational hypertension that we've been seeing with moms who contract COVID during pregnancy. For that reason, we also follow baby's growth after you contracted COVID to make sure that we're not getting growth restriction due to whatever effects it's having on the vasculature of the placenta. For my moms who had their first babies during COVID and are freaked out about going back to the hospital, take a deep breath. It's not like that anymore. We're back to our 4 visitors plus your DONA certified doula. We're not requiring masks in the room or in labor unless you are actively COVID positive when you're laboring. If you are COVID positive when you're in labor, we do not separate moms from the babies. We give you an isolette to protect baby from the respiratory droplets in the room and give you N95 masks as well. All right, I will answer these 2 questions while you look at my poll question. I'm 14 weeks. Can I sleep on my belly? Hold on. If it's still comfortable for you, it's fine. It's going to become uncomfortable for you very soon. And when that happens, then just turn on your side. Next question. What if my prenatal gummies make me vomit? I bought 2 different bottles and they both smell terrible. I'm sorry to hear that. Then it may be time to talk to one of your providers about something, about some medicine for nausea or for the vomiting. So the question we have out here right now is, what information can you find on the website? And I can see all of you have already given me the right answer. The birth plan template, safe meds in pregnancy, what to expect at each visit, and STAR test takers have given me all of the above. All right, please remember that we are social. We are on all of the things, so please follow us. The next question I have out here is ondansetron safe for regular use? Yes, absolutely. That's the generic for Zofran for anyone who does not know that. So yes, there is not any association with fetal teratogen with ondansetron proven in the literature. So please follow us on all the things. You'll see really cute announcements and, more importantly, really great birth stories. Lots of you are here because you heard somebody else's birth story at Full Circle and you're like, I'm going to give me some of that. All right, so you're welcome to, and we're excited to share your rockstar birth story when it all goes down. So thank you for your time this afternoon. I appreciate all of you rocking with me to the end. Remember, this will be available on our YouTube channel later on, and thank you so much for trusting us to be your team. Bye. See you next time. Bye.